Hello, everyone. Tonight, we're diving into the wild world of healthcare, specifically the Affordable Care Act, or, as it's more colloquially known, Obamacare. The Affordable Care Act, signed into law in 2010, was a monumental attempt to fix America's broken healthcare system. For years, millions of Americans were uninsured, unable to afford even basic medical care. The system was a confusing mess, with insurance companies free to deny coverage for pre-existing conditions like having the audacity to be born with asthma. The ACA aimed to change that. Its goal was to expand health insurance coverage, protect consumers from insurance company abuses, and slow down the rising costs of healthcare. Think of it like trying to fix a car while driving it down the highway. A risky move, but something had to be done. It tried to build upon ideas from both parties, even borrowing concepts from Mitt Romney's healthcare plan in Massachusetts. But despite its bipartisan intention, the ACA has been fiercely debated since its inception, with the conservatives labeling it as a socialist agenda and naming it Obamacare. Now, let's talk about what the ACA actually does. First and foremost, it expanded health insurance coverage to millions of Americans. It made it illegal for insurance companies to deny coverage based on health status. It also allowed young adults to stay on their parents' insurance plans until age 26. For those who still couldn't afford coverage, the ACA expanded Medicaid, a government program for low-income Americans. The ACA's impact goes beyond just expanding coverage. It banned lifetime limits on coverage, meaning insurance companies can't just cut you off when your medical bills get too high. It required insurance plans to cover essential health benefits, fundamentally shifting the balance of power in healthcare. Okay, let's talk about those essential health benefits. Before the ACA, insurance plans could be like those discount airlines where you have to pay extra for literally everything. The ACA mandated that all individual and small group health insurance plans cover 10 essential health benefits. These include things like ambulatory patient services, emergency services, hospitalization, and maternity and newborn care. It also covers mental health and substance use disorder services, prescription drugs, rehabilitative services, lab services, preventive care, and pediatric services. The idea was to make sure that everyone has access to basic, essential healthcare services, regardless of their income or health status. The ACA's ongoing struggle and challenges. Despite its successes, the ACA is far from perfect. One of the biggest criticisms is that it hasn't done enough to control healthcare costs. While the rate of healthcare cost growth has slowed since the ACA's passage, it's still a major burden for individuals, families, and the government. The ACA has been subject to constant attacks and attempts to repeal and replace it multiple times. This political instability creates uncertainty for both consumers and healthcare providers. The ACA's individual mandate, which required most Americans to have health insurance or pay a penalty, was controversial and ultimately repealed. The ACA was just the first step in a long journey towards affordable, accessible healthcare for all Americans. Strengthening the ACA for the future. So, where do we go from here? You might ask, can I still look forward to having coverage through ACA in the coming years? That's a question that needs to be addressed by our leaders. The challenges facing the ACA need to be addressed to ensure that all Americans have access to affordable, quality health care for the foreseeable future. First, they need to acknowledge that the ACA has been a net positive for millions of Americans. It has expanded coverage, protected consumers, and improved the quality of care. They need to find ways to control costs, stabilize the individual market, and address the remaining gaps in coverage. This will require a bipartisan effort focused on finding common ground solutions. Ultimately, the future of the ACA and healthcare in America depends on the willingness of everyone to work together to find solutions that benefit all. Because everyone deserves access to quality, affordable healthcare, regardless of their income, employment status, or health condition. Let us know how we can help you choose the best health option for your situation. Leave a question or comment, and don't forget to subscribe so you get updates. See you in the next one.